My name is Sophie Leblanc. I work on the partnerships team at Transit. Most of you know us already, but for those who don't, we're an app that's built for transit riders. So we support over 200 cities, mostly focused on the US and Canada. And we connect riders with real-time information, trip planning, fare payment, and other mobility options as well. We also partner with transit agencies on these projects, so over 60 in the US and Canada. Public data standards are really our core, and that's what allows us to help deliver a seamless multimodal experience to riders. So during the pandemic at Transit, we've been focused on working with agencies on getting the most up-to-date info to the thousands of people that are still riding public transit. We're also assisting agencies with data and analytics to help them deliver this critical service to those who need it during the pandemic. Which leads us to today's Q&A. So during the pandemic, we've found ourselves at Transit in a unique position to be able to answer the question, who is still riding public transit? So in today's Q&A, we'll be sharing results from over 20,000 survey respondents on topics such as demographics, reasons for travel, travel pattern changes, and what they've heard from their agency since the crisis started. So today's Q&A will be led by two of my great colleagues, Emily Gates and Jonathan Sheff. Emily Gates works on the partnerships team with me at Transit. She has a background in data science and operations for bike share, and she used to be the general manager of the bike share system in Boston. We also have Jonathan Sheff, who's a data scientist at Transit. He assists our transit agency partners with answering questions about their network and their riders. He has a background in neuroscience and statistics. He's not a brain surgeon, but he's pretty smart. So you may have interacted with Emily or Jonathan in the past. If not, you might after today. But in any case, we hope that they'll be able to share some really insightful insights with you today. So that takes us to our agenda for today. So our Q&A will last about 60 minutes. So first of all, Emily will start with an overview of the trends in transit demand that we've been seeing. And then Jonathan will dive into the meat of the Q&A today, which are really the survey results themselves. Emily will then come back and dive into two cities specifically where we've seen the most survey responses. And finally, at the very end, I'll be moderating the Q&A period. And so many of you have submitted questions before the webinar, so we thank you for that, and we will do our best to answer most of those. But we also encourage you to submit questions during the webinar. And to do so, you should be able to access the Q&A button at the bottom of your home screen on Zoom. And if for some reason, you wanted to ask us another question or something escaped your mind and it comes to you afterwards, don't worry, you can, of course, always contact us and we'll do our best to answer your questions. And this webinar will be recorded and you'll all be getting a copy in the coming days, as well as a summary of our analysis. So, if you fear that you miss information, don't worry, you'll get a copy of all this. So as mentioned, we've gotten over 20,000 full survey responses, which makes for a lot of data in a lot of cities. So the insights that we're sharing are really focused on national trends in the US and Canada. We do talk specifically about some cities, but if you don't see your city, we may be able to provide specific information to you. So please contact us after the Q&A. Our email address is partners@transitapp.com. So we'll show that at the end of the webinar again. So without further delay, I'll pass it on to my colleague, Emily Gates.
Hi, everyone. Glad you're here today. Before we can answer who's on board, we have to answer how the overall number of people riding has changed. If you haven't already, I recommend visiting transitapp.com/coronavirus when you can to see the data I'll be talking about during this session. We're tracking how much overall demand has changed for public transit. We're currently looking at how often people are opening our app as a proxy for demand for public transit. and comparing that to what we'd normally expect to see during this time of year, and based on our growth patterns over the last several years and months by agency as well as by metropolitan area. Where available, we've also actually used daily ridership values to validate the information that we're displaying to you. And as I mentioned, it's available at transitapp.com/coronavirus. Why are we doing this? Well, the hope is to build something useful, not just for understanding that, yes, generally speaking, people have stopped riding transit, but also to understand differences between regions. And we hope that this is an indicator of when riders will return, the ways in which they will return, and be able to give agencies and cities access to more specific information about what's happening right now before it's available in any of their internal diagnostic tools. Some interesting trends that I wanted to draw your attention to on this chart is that we saw earlier drops in the Seattle and San Francisco Bay Area to align better with what we're seeing overall in the COVID curve, as well as generally speaking, Canadian cities have seen steeper reductions in transit demand overall. Way to go, Canada. And we also are seeing that the South and Midwest have seen smaller changes in demand than on the West Coast and the Northeast, based on information we've seen so far. We are also showing on that site demand over the course of how demand over the course of the day has changed. Essentially, there's no more rush hour crush. The top line, as you see, is a normal Monday based on our analysis of previous years and our growth in demand. And you can see what yesterday was, as well as a week ago yesterday. And this is all available to you right now by metropolitan area and by agency on our website. We're in a unique position to be able to look at demand industry-wide, given that our user base has proven to be representative of the market. We have automated it. It refreshes every hour. Anyone can access it. And you can also request raw data of this page as well that we can provide to you, in a follow-up message. We've been in touch already with transit agencies, economists, journalists, looking for better information on what demand is looking like for public transit, and we hope that this can be useful to you as well. Of course, we wanted to dive deeper into who's behind these statistics, so we ran a survey. With that, I'm going to hand it over to Jonathan to talk about the results.
Hi, thanks, Emily. Thank you all for coming. I'm having a moment of cognitive dissonance because I know there are a lot of you out there, but the only person in the room is my dog Loki, and he's not a person, but thank you for coming. As Emily said, we have a question of who's riding right now. So we sent out a survey. What you're seeing on your screen is a screenshot of our app, and we send out a banner that people see at the top of the app, and they can click it if they want to participate. So it is a convenience sample. We sent this globally. And in this talk, we're going to focus on, if you look at the next slide, we're going to focus on North America. If we can go to the next slide. There we go. We're going to focus on North America in part because we have so much data there, but also I'm going to focus a little bit on the US today because we've done surveys there recently in Pittsburgh, Las Vegas, and that will give me a baseline of comparison for some of the demographics we're going to talk about in the COVID survey that we did. While we're looking at this map, so this is a map of the locations where we had survey responses. I just want to make super clear that we honor user privacy very much at Transit. It's something that's very important to us. We only use user locations in aggregate and with their permission. So in this survey itself, there's a very clear option to opt out, and then we just don't connect their app behavior to the survey. Next slide. So we had 15,000 respondents in the US, 10,000 respondents in Canada. We asked about transit usage, employment, demographics, how they're receiving alerts about changes in transit. And I'll focus again, as I said, on the US, but I'm going to talk about Canada and how it varies from some of these trends that we're seeing. So let's start with the demographics that we're seeing. We saw a clear skew in the current ridership towards being more female than before. So if you look at these top two pie charts, on the left, you'll see our previous survey in Pittsburgh, where there's a pretty even split. And then on the right is the survey we did recently in the first week of April for people who are still active in transit app during the COVID pandemic. And you can see 61% of your users identified as female, 33% as male. So there's this clear skew towards female. This same happened in Las Vegas. 47% of users identified as female before, 54% now. And so it varies from by city to city, but this is a trend we saw across the US and Canada. So here's Pittsburgh again. In gray, you'll see the survey that we did before the pandemic, and in green, you'll see the survey now. And you can see this group, 25 to 44, this youngish group, they've dropped. So the ratio of sort of the older and younger have risen. And so there's this drop in age group, in that sort of middle youngish age group for the people who are riding now, or rather, sorry, the people who are active in our app now. Again, this is a survey of our app users. The assumption that we're making throughout is that our app users are people who are actively trying to get from point A to B. People generally don't go into our app just to play games or something, because we don't have games in our app. It's a transit app. So we're assuming that they're out there to get around. We're seeing that the current riders are skewing towards lower income brackets. I don't have a national or global survey for income that we did with our users before COVID. So I'm comparing to the APTA 2017 statistics of transit riders. And so comparing to APTA statistics, we're seeing a skew towards the lower income brackets. You can definitely see these higher income brackets, above 75,000, above 100,000. We're seeing a drop off in riders. So maybe there's a story emerging that the higher income brackets can afford not to ride more than the lower income brackets, which would make sense. Another clear disparity we've seen is in race. The people who identified as white were underrepresented in the current sample of the survey. People identified as African American, Hispanic, Pacific Islander were overrepresented. Again, painting a picture that they're of inequity in the ability to stop riding and stop using public transit. Here is Pittsburgh. Again, now I can compare apples to apples. In the Pittsburgh survey before COVID-19, you can see in gray and then in green the current survey, the April survey. And again, so people who identify as white are currently underrepresented. People who identify as African American are overrepresented. So it's a trend we see in Pittsburgh, where I can make a more clear comparison, and I think nationally. In addition to transit patterns, we were able to ask people about their employment. We asked them whether what their job status was before, full-time, part-time, unemployed, and then how it changed. Did you have a drop in hours, a drop in wages, or did you lose your job altogether? Or did your hours go up and your wages go up? So of the people who had negative impacts, loss of hours, wages, or job, you can see a clear association between education level and negative job impacts. And so to be clear, again, you can see, people who didn't complete high school, that's a high percentage of people who had negative job impacts. This isn't true for the whole population. It's true for the people who responded to a survey in our app, the people who are active in our app right now. And that's a clear distinction to make. We clearly did not survey people that we didn't survey. Okay. So we looked at the patterns in employment, and we asked people the industry in which they work so we could get a sense of who needs to ride. And these were, as we'd expect, people in healthcare, sales, food preparation. These people, this is the percentage of people in each industry who said they're commuting for work. So that top bar says people in food services, 18% of those people are commuting for work. And then, not surprisingly, maybe the office and lab jobs, management, legal, a smaller percentage of them are riding. Similarly, the distribution of people who answered our survey follows this distribution. So we had more people answer our survey who are in healthcare, food services than people who are in legal services. And again, that makes sense. We distributed the survey through an in-app banner, so the people who aren't riding probably aren't opening our app. To continue this thread of equity, we looked at the overall drop that Emily had introduced before over time. And you can see that in Los Angeles, the bottom line is people whose phone is in Spanish, and the top line is people whose phone is in English. The people whose phone is, the Spanish speakers, they have a much less steep drop. Like, they kept using transit. They didn't drop as much as the people with their phones in English. This is continuing to build this narrative of inequity and the ability to stop riding or stop working. Unfortunately, in the United States and in Los Angeles, there are associations between socioeconomics and race and geography, and so this is building on that narrative. The Android versus iPhone disparity, you might not have thought that this might be surprising, but in our surveys before, the people who have iPhones are actually correlated to the higher income brackets. So a higher percentage of the higher income brackets are iPhone users than Android users. And so this is another way we could look at the data and get a sense of the inequity and the inability of lower income brackets to stop using transit. So again, one of the questions we asked is who can work from home, and unsurprisingly, the office and lab jobs can, the food prep service, the food prep and protective services, things like that, they can't. And this is, again, among people who are still riding for one reason or another. So one thing I was really interested in is my teammate Etienne pointed this out a while ago when we were building this, that the rush hour peak now looks like it's earlier than, especially the morning rush hour peak, than it used to be. So if you look at this chart, the big green line is a normal Monday, and the yellow and light green lines at the bottom are the last Monday and the week before. It's hard to tell on this scale, but the morning rush hour peak is about an hour earlier now. And we were really curious about whether people are leaving earlier or just the former peak dropped while the early departures just kept leaving early. So we included that in the survey. We asked about people's departure patterns, whether they're leaving early, returning early, et cetera. And there's a clear pattern in the morning. 34% said they're leaving earlier, compared to just 9% who said they're leaving later. Whereas in the evening, it seems more spread out. 21% said they return earlier, 32% said that they return later. And you can even see this in the chart a little bit. There's that sort of second little peak in the evening rush hour. So people's departure patterns have changed, presumably in response to the social distancing edicts of the current moment. Well, another interesting question we had is, I think this was a question, Emily, you had, was, are people shifting then to different modes of transportation? If they're not taking the bus or the train, are they taking bikes or bike share or ride hail more? And we were surprised. It turns out, no. Overall, people's patterns for the other modes of transportation haven't changed. Whereas there is a drop in how much they're using public transit. And this is among the people who are still out there trying to get from point A to point B. Again, the people who are using our app. So we were surprised that they hadn't shifted their modes a little bit. I used this one. Previous slides have been from the US. This slide is from Canada, in part because their drop, the percentage drop of people who are using transit was bigger. It was smaller in the US. So again, I think Canada is doing a better job of social distancing maybe than the US, but let's see. So among those still, so we asked them the purposes for why they are commuting right now. Like, why are they using public transit specifically? Not just where they're going in general, but why are they using public transit? And you can see drops across the board. Fewer healthcare is for medical appointments. Leisure appropriately dropped. You can see work dropped, but not that much, which you might expect from the people who are currently active. Something that might be useful to agencies is that we ask them how they're staying up to date on service changes. And the predominant answers were in digital media. You can see the least frequent sources of information for how people are learning about service changes is we're in signs, like physical signs in the vehicles themselves, or in-person agents at the stations. And that could be a good thing. It could mean, these last two are the in-person options. So people are avoiding in-person interactions. So that could be good. We don't know if these two options just weren't frequent or if they were ineffective, but it's something for agencies to think about. So I focused a lot on the US, but I'd like to point out some of the differences between Canada and the US. So there were a lot of similar patterns. The riders during the pandemic in Canada are disproportionately female, people of color, and young. So for example, the age disparity was actually greater in Canada. It was 55% of them are below age 34 who are currently riding. Income distribution of respondents in Canada, that distribution was more similar to the population distribution. So there's less inequity in terms of income of people who are riding now. And there was a similar distribution of occupations commuting. It was really healthcare, food services, maintenance services, things like that. Another interesting thing that was more equitable was that in Canada, there was the loss of hours or wages or job in Canada was more evenly distributed across education levels. And then from a few slides ago, current users in Canada are using taxi and ride hail and transit even less than before compared to the US. So again, good job, Canada. And 64% of Canadian respondents are riding public transit less often compared to 50% who in the US who said they're riding less often. So I think that's about it for those two. Emily is going to talk about New York and St. Louis to compare two different cities. And the thing I'll leave you with is this was a big survey and there's a lot to it. And we closed the survey a week ago. So there's a lot more to do. There are a lot more questions we want to answer. And I'm excited to hear your questions and your thoughts on this work at the end.
Thanks, Jonathan. As Jonathan mentioned, now we're going to take a deep dive into two systems in particular in the hopes of applying a lot of the global trends more locally. So we highlighted both New York and St. Louis as opportunities to do a little more digging. We received a lot of responses from both cities. This is actually a map of all of those responses in each city. So you can see it's pretty widespread and more universal in terms of the people who are using our app to respond to this survey, even today in the instance of COVID. So we chose the largest city in the data set and a medium-sized city with a lot of responses. We chose these two also as a nice comparison between cities at different points in the COVID response curve, as well as an opportunity to compare populations that vary in terms of public transit adoption. As you can see, both curves follow a typical path of a typical downward trend that you can see sort of universally across North America as cities adjust to the new normal. But interestingly enough, you can see that New York demand responded a week later than St. Louis and was a much stronger reaction to COVID. The trend plunged over the course of a week from just hovering around no change from previous weeks and last year, all the way down to 70%, and maintained that level consistently since the stay-at-home order was put in place. St. Louis, however, had a much more gradual decline over that period of time. And we also highlighted that St. Louis's response was a little bit more inconsistent, vacillating between 40% and 60% drop beginning when schools were closed on March 18th. St. Louis is about 20 days behind New York in terms of the projected peak of daily deaths from COVID. And they had a different approach to closing schools 5 days after New York and issuing a stay-at-home order 15 days later. One thing that's important to note is that both cities or both systems suspended bus fare collection on the same day, and I'm going to talk about that in more detail in a couple of slides. In terms of income, according to our survey respondents, much like Jonathan said about incomes more generally, the higher income riders in New York and in St. Louis have all but left transit. We're seeing even more than usual lower income riders who make up a larger proportion of the riding population. 60% of low income respondents say they are riding transit as much or more than they were before COVID. And this can be associated, as Jonathan mentioned, to increase hours for healthcare workers, modified hours for those in food prep, and the loss of full-time jobs, which are replaced with multiple part-time jobs. St. Louis is generally speaking less affected than New York, as you can see in the data, but both systems are affected by COVID in this manner. From an occupation perspective, here are the top occupations for those still riding in New York and St. Louis. Different rider profiles are to be expected in cities across different points on the COVID curve. As you can see, depending on where a city is in the process of managing COVID, the more essential healthcare workers are riding transit to work. 34% of the survey respondents in New York are working in healthcare, And we deliberately divided the healthcare support role from the healthcare practitioner role, as it's important to highlight the difference between those who work in a hospital and those who are explicitly working with patients in a hospital, not only in terms of job function, but also in terms of where they fall on the income scale, where they fall on the affected hours scale. As an aside, my family works in healthcare, and they have seen lots of interesting things going on in the world of layoffs, especially around nurses and doctors in areas that are not affected by COVID, in a way that the support staff may feel overburdened. They're actually feeling less burdened on the practitioner side of the house in places that are not explicitly affected by COVID yet. Back to transit information. St. Louis has not been affected as significantly yet when we did this survey a week ago. And food workers are the single largest group of individuals working and riding on transit during this time frame. One interesting question that has come up both in our conversations with agencies prior to this, but also as a result of sort of seeing the user surveys come in and information about questions that were asked in anticipation of this webinar. A lot of people are talking about the impact that eliminating the bus fare has had on ridership and on types of riders. Over 40 North American agencies have eliminated fares and instituted backdoor boarding to increase the distance between operators and riders in the hopes of keeping operators safe. There's been concern from amongst agencies and the public that eliminating fares induces demand, because now that the ride is free, it encourages more people to ride the bus, making more unsafe conditions for the operator and other passengers. This chart shows the demand for buses in New York, for the subway in New York, and St. Louis's entire system. And it just so happens that on the same day, both systems eliminated fares on the bus. Now we know that not everyone uses an app to check for the bus before getting on, and this could include the homeless, who may not be accounted for fully in our survey results. This is also not to say that along particular routes or at certain times of day, there aren't more people riding the bus than would be with fares in place, fare collection in place. But on the whole, among the broad base of users who use our app, we aren't seeing spikes in demand for those routes that have eliminated fares. We chose these two systems to compare user survey responses, but keep in mind that you can do your own exploration of this data on our website about particular systems that are of interest to you. So if you have questions about what's going on in Nashville or in Tacoma, Washington, you can compare those agency feeds on our website directly and answer more of these questions and add a ton more variables than we've been able to do so far to that analysis. So now we're going to talk about what we at Transit expect to do next with our survey responses. Now that we've looked at the high-level results and highlighted those responses in the context of a couple of cities, we'd like to further explore the city-level trips. Where are people still going? Are certain sections of the city more active than others? Are certain routes more popular among this group of riders than others? We want to connect it to agency and partner data sets for validation. We'd love cross comparisons, not only at the city level, but also at the agency level in terms of how this is impacting not only ticket sales, but the types of passes that are still in use and being utilized. We think there's a lot to be worked on there. We also want to work with agencies and cities on localizing the survey results so that we can answer more specific questions like, what's happening in Ottawa and how does that vary from Montreal. So with that, I'd love to point in a direction and hope that the slide changes. I'd love to hand it over to Sophie for Q&A.
Yes, it wouldn't be a real webinar without some sort of technical issue. So I think we're checking all the boxes. So thank you very much, Jonathan and Emily. Those were really compelling results and insights. What I'm hearing is that Canada's doing great. So I'll take that as the takeaway as a proud Canadian. But on a more serious note, the equity issue was really striking throughout. And that, of course, makes it even more important for transit agencies and their riders to be getting the most up-to-date information, because these are, of course, the people that are depending on it more than anyone else. So we hope that this has been really insightful for all participants and transit agencies. We're going to move on to the Q&A now. So many of you submitted questions during the webinar, so thank you for that. So we won't have time to answer all of them, of course. So as mentioned, we'll be happy to answer a few of them following the webinar by email, but of course, feel free to get in touch with us with any further questions, because we would love to hear from you. So the first question we have here, I'll direct this one at Emily. Did the survey take a look at car ownership at all?
Yeah, absolutely. So we did not make a specific slide for it because there's just, an ungodly number of slides already in this presentation. But interestingly enough, we found that 85% of respondents do not have access to a car, period. So the question we asked was, do you have a car? Do you have access to a car but don't own a car? And do you have no access to a car? So with that in mind, overall 85% did not have access to a car or own a car. And that was particularly true of those who made less than $30,000 a year. So below that value, that number jumped up to above 90%. Have no access to a personal vehicle and must rely on transit and other means to get around.
Right, so this makes the equity issue even more striking then. Jonathan, could you tell us a bit more about who lost their jobs due to COVID-19 from any survey results?
Yeah, within the survey, 22% of people in food services lost their job. And for other industries, it was in the single digits. So food services was hit hardest, which I think makes sense, as we know restaurants are closing and staff are being furloughed or laid off. It's a good question, because also it's another opportunity for me to highlight our survey. Our survey is of people who are using transit, and so it's 22% of the people in the food industry within our survey were laid off. It doesn't mean that's true of the whole population, because this isn't a survey of the whole population. It's of people actively using the transit app.
Right, something to keep in mind, but nevertheless, of course, very insightful.
Yeah.
We'll go back to Emily for this next one. Did you do any surveying about how transit agencies are responding to the coronavirus?
We have been having conversations with agencies specifically and asking them a series of questions about what their future looks like. And we have also been actively tracking every day the 90 or so agencies that have either filled out our form to be able to be included in our agency updates database, as well as actively seeking out some of the larger agencies for changes to their services, such as eliminating fare collection, instituting backdoor only door policies. We've made all of that information available at transitapp.com/coronavirus. What we have found is that with over 90 agencies responding and us going out and actively seeking out that information, that agencies are able to hopefully learn from each other in that space, and also for researchers to be able to understand the current policies. I think that there's going to be a lot of opportunity in the future for taking this database and applying it historically over time to say the policy changed from allowing fare collection to eliminating fares altogether, or to going to only visual validation fares. All of those kinds of insights can be gleaned in the months to come.
And following again on that note, do you have any insights on what agencies are doing about crowding, or what does crowding look like with fewer riders but also less service?
Sure. So crowding has been varying significantly from agency to agency, as well as line by line. For example, Houston Metro started the great trend of putting in signage in all of their vehicles on every other seat to ensure that people would not sit on them. And that was quickly adopted by Pierce Transit, who printed out and laminated over 3,000 signs to put in their buses. But we thought we could do a little bit more to help in that space. So last week, Transit rolled out crowding within the app. We are taking APC data. APC stands for Automated Passenger Counting, information that is being provided by the agency through GTFS or through an API. And we have integrated that information into the app so that riders can see how crowded their vehicle is and can make their own determination about whether or not that is a safe vehicle for them to enter. I know that agencies are also instituting policies about the number of riders that they can accept on vehicle types, and then skipping stops with that information. We have integrated that kind of data into our agency response database and are including it in our banner to be able to accommodate that.
Great. Yeah, there's a lot of conversation starting around crowding and what different cities are doing, whether they keep the thresholds of what they consider as crowded at the normal 40+ level, or do they bring it down to 10, especially in the data that they're putting out. So this question would be for Jonathan. Are you correlating your data with information about outbreak timing? So stay-at-home orders to help understand the casualty of transit usage drops.
Yeah.
Causality? I'm interested in casualties, but I think causality.
Yeah, you little typo there.
Yeah, so it's something we're starting to look at. Causality, as I think a lot of you know, is something that's hard to prove, right? Like, we can't show that one event in time caused a drop or caused a not drop because there's no counterfactual. But we are looking at these key events in time and trying to see if behaviors changed afterwards. Emily presented on whether making fares free, for example, if we saw some significant rise in app usage as a proxy for ridership, and we don't. And so, yes, we're looking at those kinds of events. So far, I don't know if your question was specific to any one kind of event, but so far we've seen that the stay-at-home orders, for example, we haven't necessarily, like, it's been a mixed bag. So it would depend on location, but it hasn't always, we haven't seen necessarily a steep drop right after the stay-at-home order, for example. so that it would be location dependent.
Understood. Another question coming in. Let me just make sure haven't gotten any typos. Are there, so one thing I don't think we discussed is people's perceptions of their transit agency. Are there any questions you can think of about perception of maybe even transit safety compared to driving and not taking transit? So do people feel safe taking transit right now? Do they perceive transit as not clean, perhaps?
I can take that one.
Sure.
So we did ask in our survey about agency responses with respect to policies that were in place that agencies were doing, and whether or not riders were aware of these policies. From what I can tell, almost half of respondents replied that their agency was doing additional cleaning work. We had 68% of respondents say that their agency had instituted a backdoor boarding policy, and 34% say that their agency had responded with a canceled route or canceled route information. The percentage of people who said that they either did not know or that their agency had made no changes was very low in this survey, which leads one to determine that users are really respectful and understand that the agency is doing everything that they can, and that the communications are working, as indicated by Jonathan's slide about how people are receiving information about service changes. That is true not only of perspectives on safety, but also how they're getting any of their news is coming through social media, is coming through the banners on transit, and people are receiving the message, and I think they're grateful. We've seen anecdotally social media messages directed towards us, which we have been passing along to agencies that say, like, we know you're doing all you can, we're really grateful.
That's really great to hear. And yeah, of course, these are not regular times, so we can imagine that commuters who on a normal basis would not need to necessarily look for updates other than regular service alerts, they're now checking information every day, and they need to stay informed whether service has changed. So we've got a question about students for Jonathan. Are the income disparities you saw due to the fact that you have a lot of students using the app?
That's a really good question. I think maybe a misperception sometimes I get about our data is that it's all students, but we have a really decent representation of the population, including across income brackets. So for the $10,000 or less income bracket, that group is slightly a larger percent of the 20%, 22% of that group is students. But for all the other income brackets, it fluctuates between, say, 15 and 20% of that income bracket is students, all the way up to the $150,000 or more group, which, by the way, whoever is out there who's a student earning $150,000 or more, like, I'd like to shake your hand. I don't know if that sounds great.
Yeah.
But yeah, so students actually don't drive a lot of the relationships I talked about today, and well, actually any of them. So we did look at it. We've sliced this many different ways. I see a lot of the questions in the Q&A are about slicing it a different way. You know, Stephen, you asked about if there are race income disparities and how customers were reacting, and there's so many different ways to slice it. And I think in our 9 minutes, I'm not going to be able to address all of them, but we really do welcome questions after this webinar. It's really interesting. Similarly, I'm seeing a lot of questions about methodology. Diane, you were asking about how we weight different metrics, and some others about how we calculate things. And I'm very happy to talk about those things, but I don't think 9 minutes allows for it. But yeah, back to the students, no, students aren't driving the relationships I talked about today.
Got it. So we'll take, maybe for sake of time, 2 more questions. I'll direct this one at Emily. Did respondents give any indication about how much they think they'll ride in the future after the stay-at-home orders end?
So we did not explicitly ask the question about what happens after. And I think one of the reasons we didn't ask it directly is because every week is another opportunity for all of us to say, is it going to be another week? Or is it going to be another 6 weeks? And so we were trying to really figure out whether or not what was happening now and how could we use what was happening now to help agencies inform the future. That being said, I hope that our essential services workers get a couple more days off in the future. Based on our responses, we had a lot of people who are working a lot more or not working at all. And so with that in mind, I could imagine a situation where, people are going to continue to ride and continue who are already riding now. But the bigger focus for agencies and for cities is to think about those of us who are working from home, and those people in Jonathan's slide about computer workers, and I never refer to myself as a computer worker, but in this context I'm definitely a computer worker. What am I going to do in the future? I hope that means that I will continue riding, or start riding again.
Future work for us. I mean, it's a great question that we hope to answer with future survey work, future analyses.
Yep, I think
exactly. And Bixi opened today in Montreal, and I can tell you exactly what I'm doing after this call.
Bixi is our ride sharing, or bicycle ride sharing.
Bike sharing,
Yeah,
not
bike
the
sharing.
same.
I know.
But I think one takeaway is that, I mean, we've been head in this situation for a little over a month now, and something that's clear is that it keeps changing every week. So as this continues to evolve, I think we'll all need to adapt and keep up with the latest transit information. So to go with the final question, did respondents, oh no, I did that one. How do your ridership stats compare with actual transit ridership numbers? Do you gather the numbers directly from transit agencies, Jonathan?
Yeah, that's a great question. So when we first built the model that you see on the dashboard that Emily presented at the beginning, there weren't many daily ridership stats out there. We reached out to some agencies, but to be honest, some of it just came from Twitter. Like sometimes an agency tweeted their daily rider. We took everything we could get, but we definitely, we keep aiming for as rigorous a process as possible. We reached out to agencies to ask for daily ridership stats. We took everything we could, but they're just not that common, the daily ridership stats, and some agencies aren't capable of giving those. So we validated with those stats where possible, and it turned out quite well for the most part. There were a couple either days or cities where we were more off, but in general, it was, I'd say, 5% off, and that's a decent difference. It was encouraging for our model.
Yeah, that's really exciting to hear. And as we've talked through in the questions, I think that all of this situation will really push on in terms of data collection and sharing among transit agencies. So something, for example, like APC data and crowding in real time will become even more important, and that will allow transit agencies as well to be able to get a better idea in real time of what's going on with their network.
And for the people in the audience who work at agencies or people who have these kind of data, I would love to talk to you. I'd love to collaborate and build models together with shared data. I think that'd be great.
Definitely. So to not lose my on-time performance, I'm going to conclude this Q&A. So thank you both again to Jonathan and Emily, and thank you to all our participants. You were really many in attendance today, and we thank you for that, and we hope discussion and considerations that you can apply to your work. So as mentioned, we'd love to hear from you. You can get in touch with us at partners@transitapp.com, either for more information, for any specifications, or if you're looking for data specifically for your city. And as Jonathan mentioned and Emily mentioned, in the coming weeks, we will continue our analysis. So we have a lot of data still to go through, and we'll also be extracting additional app data in order to dive more into the insights that we've already offered, but also bring up new ones. As mentioned, this webinar was recorded, so we'll be able to send it to you by email in the coming days, as well as a summary of our analysis. So thank you again to you all, and stay safe.